Good afternoon. I call this meeting of the Human Services Policy Committee to order. Members, please take your seat. We do have a quorum present, and our first agenda item is approval of the meeting minutes from Wednesday, February 26th. Is there somebody who'd like to make a motion for approval?
So moved, Mr. Chair.
Representative Baker makes a motion to accept the minutes of February 26, 2024. Is there any discussion or corrections? Hearing none, all in favor of approving the minutes of February 26, 2024 signify by saying aye.
Aye.
Those opposed say nay. Motion carries and the minutes are approved. Our first item of action today is taking up House File 3646, the Department of Children, Youth, and Families Recodification Bill from Chair Pinto. We now have it officially in our hands. We did have an informational hearing on this last week, so our primarily intent today is to hear any final words of wisdom from Chair Pinto and then vote to move this on to the next committee. And with that, I would like to move that House File 3646 be re-referred to the State and Local Government Finance and Policy Committee. Chair Pinto, welcome to the committee. Do you have any further comments that you would like to provide us today?
Thank you, Chair, and apologies, members, again for the separation of having heard the bill last week and now taking action this week. The only update, Chair and members, is in response to questions from Representative Baker, and I sent this information to him. He had asked about the physical location of DCYF staff, and I got the response that they will be in the 444 Lafayette building, which is the current DHS building where Children and Family Services staff are. That'll be at least for a couple of years while they figure out long-term plans. But I did want to make sure to give a public response to Representative Baker's public question regarding that. And nothing further, just would greatly appreciate members' support to get this technical bill into law on behalf of our reviser and nonpartisan staff.
Thank you, Chair Pinto, and appreciate that further update there. Are there any other questions from the committee members? Not seeing any. Chair Pinto, thank you so much for being back today. I renew my motion to refer House File 3646 to State and Local Government Finance and Policy Committee. All those in favor signify by saying aye.
Aye.
Opposed say nay. Motion prevails and House File 3646 is referred to the State and Local Government Finance and Policy Committee. Thank you, Chair Pinto, for being here today.
Thank you, Chair. Thank you, members.
Our next bill that we have today is House File 3711, Representative Hicks' bill. Representative Hicks, if you'd like to come down to the testifier table. Representative Hicks, would you like to move your bill?
Yes, Chair, thank you.
Okay, Representative Hicks moves to re-refer House File 3711 to the Human Services Finance Committee. If you'd like to go ahead and introduce your bill for us.
Thank you so much, Chair and committee members. I am excited today to share a little bit about House File 3711, which will allow out-of-home respite for children to be offered in an unlicensed setting. Respite is a vital service that supports families throughout the state. Access to safe and reliable respite options is crucial for families needing to take a break from their caregiving responsibilities. In 2020, a change was made where out-of-home respite for children could be provided, limiting the service to only licensed settings. This change resulted in the loss of trusted options for many, many families, and also availability for many families. With me today is Sarah Grafstrom from ARM, and ARM has been engaging in conversations with the department since this change was implemented and worked through language to try to find a solution to this problem for families. I want to be clear, we are still having some of those conversations as we look to make sure that this is both safe but also accessible. I'd really like to turn the attention to two letters that you'll see in your files really talking about how important this is, and I will let my testifier walk through the bill language.
Okay, very good. Thank you, Representative Hicks. We'll first go to Ms. Sarah Grafstrom. If you'd like to introduce yourself, who you're with, and welcome to the committee.
Thank you. Good afternoon. Yeah, Mr. Chair and committee members. For the record, my name is Sarah Grafstrom. I am the Senior Director of State and Federal Policy at ARM. ARM is a statewide trade association of residential service providers, providing services through the 4 disability waivers and supporting people in a variety of different living environments, from a 4-person community residential setting to an individual's own home. And through a variety of different services, including 24-hour daily services to unit-based services that might be provided just a few hours a week. One of the services our members provide is respite, both for adults and children. Respite can be provided as a daily service when an individual is accessing services for 10 hours or more in a day, or as a unit-based service, which would be used for anything under those 10 hours. Respite can be provided in an individual's family home, in a hotel, at a camp, or in a licensed setting, and for adults in an unlicensed setting. Respite can be provided by a family member or a person working under a provider's 245D license. The bottom line is respite is a unique, critical service that providers tailor and develop to meet the unique needs of their community and the people that are utilizing this service. The bill in front of you today is specific to out-of-home respite for individuals under 18 when the person providing the service is not related to the person receiving the service. In 2020, a change was implemented by the Department of Human Services that restricted where this particular type of respite could be provided. Prior to 2020, the service could be provided in a licensed 245D setting or in an unlicensed setting, as long as the provider had a 245D license and appropriate approval was received from the child's case manager and legal guardian. An example I often use that our providers shared with me of a situation that they used to support is a retired special education teacher who has a strong relationship with the family in her community and provides respite in her personal home 2 weekends a month under their local provider's 245D license. The service itself is licensed, but that teacher's personal home was not licensed. To keep providing the service following the change in 2020, that teacher would have to have her home licensed by the Department of Human Services. This change has drastically reduced the amount of available respite, specifically in Greater Minnesota, where finding a licensed setting with an opening for respite can be hard to come by. The loss of respite options have contributed to some families going into crisis and having to seek other options to get support for their child and their family. The bill in front of you will allow for this service to once again be provided in an unlicensed setting when certain qualifiers are met and with certain guardrails included. To walk through some of those, first, a background study must be completed for anyone over 13 living in the home. The child's case manager must conduct and document an assessment of the home. The child's guardian or legal representative must visit the home before the child goes to that home for respite. The service must be provided in a residential setting. No more than 4 children can be receiving the service at any one time, and everyone has to have their own bedroom. Services cannot be provided to children and someone over the age of 21 in the same residence at the same time. And finally, an individual can only be in these unlicensed respite settings for 10 consecutive days and no more than 46 calendar days in a year, unless an exception, as written, unless an exception is requested by the case manager and approved by the Department of Human Services. To close, we know that respite is a critical upstream service that supports families. Without access to reliable and safe respite options, families are turning to alternative placements for their children, including more congregate living settings and even emergency rooms or hospitalization. We are grateful for the department's collaboration on this legislation, and we are hopeful that by passing this bill, families will be able to find options for their children in their own communities that they feel safe and comfortable with. So with that, I'm happy to answer any questions.
Thank you, Ms. Grafstrom, for being here. If there's questions, we will call you back, and we'll go to the next testifier. I have a Tyler Langenfeld. If you'd like to come down, please. Welcome to the committee. If you could please introduce yourself, who you're with, and begin your testimony, please.
Thank you very much. Good afternoon, Mr. Chair, committee members. My name is Tyler Langenfeld. I live in Hastings, Minnesota, and I am the Senior Director of 245D Services at ACRA, Minnesota's largest home care provider. Thank you for the opportunity to speak today in support of House File 3711. At ACRA, our mission is to improve lives by providing individualized home care supports and services to people in their homes. We accomplish this mission by offering a variety of service options, including out-of-home respite services under our basic 245D license. Specifically, ACRA administers out-of-home respite services for children and adults in unlicensed settings, essentially in the homes of the individuals we hire to become the employees. As you can imagine, families face many challenges when attempting to locate potential staff to provide out-of-home respite. Family members, coworkers, neighbors, friends, these are just a few of the places that families look for staff to help them access these critical and well-deserved caregiving breaks. However, in 2019, with the passage of more restrictive language, families who were looking for out-of-home respite for their minor children in an unlicensed setting saw this same list of potential sources of staff shortened to only family members. At that time, ACRA, as an agency, publicly commented that, quote, requiring unlicensed out-of-home respite providers for individuals under the age of 18 to be related to the child dramatically reduces an already shallow pool of potential staff. This new language unnecessarily places an additional obstacle in front of families who are trying to overcome a workforce shortage already identified by the state of Minnesota, unquote. As I said, that language was from 2019, and I think we can all agree that 4.5 years later, families are still navigating that same workforce crisis. When this change went into effect, ACRA and other providers were put into a position to call all of our families with minor children accessing out-of-home respite to discover which employees were related and which were not. The staff who happened to be related, they could stay on, but the ones who happened to fall into those other categories, like friend or neighbor, their opportunity to provide out-of-home respite to their clients was over. I remember personally speaking to a longtime staff who called and asked why they were no longer able to provide out-of-home respite to a family they had been working with for over 3 years for no other reason than not being related to the child. New rules was the only answer that I could give them. As you can see, this restriction not only affected families seeking unlicensed out-of-home respite for their minor children, but also the employment of some of the people willing to provide the service. House File 3711 will work to remove this additional obstacle for families with minor children looking to access out-of-home respite in an unlicensed setting. Initial and annual assessments conducted by the child's case manager and legal representative, as well as ensuring that background studies are conducted on individuals age 13 or older living in the household, is a reasonable and sensible compromise. One that we believe will continue to help ensure that children who are accessing this vital service are receiving care in safe environments while not assuming that those same safe environments can only be provided by related caregivers. ACRA strongly supports House File 3711, and I thank you again for the opportunity to speak on its behalf. I'd be happy to answer any questions that you have, and again, thank you for your time.
Thank you so much for your testimony. If we have any questions, we will call you back down. Thank you. At this point in time, are there any other testifiers who'd like to address the committee? Not seeing any. Next, we'll move on to members. Any questions or comments? Representative Backer.
Yeah, thank you. And I appreciate not calling me Baker. Thank you, Chair. On the serious note, Representative Hicks, my question is so we're going to go, how does this work with someone who's not licensed? You know, from what I understand, and correct me if I'm wrong, these individuals, even though temporary, are going to be put into an unlicensed type of situation. Am I understanding that correctly?
Representative Hicks.
Thank you so much, Chair. Yes. So I'll let Sarah speak to some of the details, but she did share an example that is actually really common in my community, which is retired special education teachers. So a family maybe has a child who is severely impaired. Maybe the child has a feeding tube and is nonverbal and requires all of their personal cares be done by someone else. Their feeding, their bathing, their toileting, that kind of thing. And so that parent is doing a lot of that care in the home. They maybe have a PCA that comes in some, the child goes to school, but they really are providing the bulk of that care. So maybe mom and dad want to go away for a weekend. Or maybe they want to have a weekend at home. Maybe mom has surgery and dad wants to be able to focus on supporting mom for that weekend. And so the special education teacher, like the one in Sarah's example, could be hired by one of our 245D licensed providers, have a background check, the case manager, the county case manager, and the parent would go and view the home and say, we'd really like Miss Smith to support us for these 10 days while mom's recuperating from surgery, because Johnny knows Miss Smith really well. The way the law is currently written, that's not an option. And so unless the case manager can find a licensed facility for Johnny, who's maybe 12, right, to go to while mom recuperates from surgery, there's no option. So then dad has to try to find people to come into the home, maybe, to help in those 10 days, or maybe Johnny has to go, ends up in an emergency room because dad can't balance everybody's cares. Or maybe mom ends up having to go to a nursing home for care for those 10 days because there's not enough people in the house to provide the care. And prior to 2019, we allowed that. And this has been a change now where it's only family. So I'll let Ms. Gresham speak further, but that's one example that I've heard about in our community is like a parent needs surgery or needs care and they can't use unlicensed respite.
Ms. Grafstrom, anything you'd like to add?
Yeah, thank you, Chair Fisher and Representative Backer. Representative Hicks did a great job explaining it. The only thing I would add is just to emphasize the fact that the service itself is licensed. The person receiving the service is hired by the licensed provider. They have to go through all of the same training as the other staff would. They have to have the background check, all of the different 245D required trainings. The only unlicensed piece is that physical home that the kiddo is going to. And in the bill that we have, there's other safety measures in place to make sure that that home is safe. The case manager, like Representative Hicks said, the case manager is walking through the home. The guardian is walking through the home. All of those things are in place to make sure that the home itself is a safe place. It's just not bringing in the department and physically licensing the home.
And I would just like to add, Chair, before
Representative Hicks.
I would just like to add, I really trust parents and case managers to figure this stuff out as a team. I really believe they can do that. I believe that parents are doing what's best for their children at all times. Most people are trying their best just to get through the things they need to get through. And so I really trust case managers and parents to identify those situations, and I trust them to work through those processes together as a team.
Representative Backer.
Yeah, just a quick follow-up. So if I'm hearing you correctly, what you're saying right now is that the individuals that would be providing the care would go through the process. Because my concern, I would agree with you, Representative Hicks, parents are the best advocate for their children, hands down. My concern is, as you're well aware of, when you're in that situation, there are times that you let your guard down because of the stress of the situation, because, you just want to get through it. So, of course, I want to make sure those kiddos are in good care. And your scenario totally is a good example. Unfortunately, when we sit on this side of the table, we also have to look at who could be the bad apple. As we know, we will make laws that bind to that. My last question here, where does the department weigh on this? Is this, I don't know if someone's here from the department, where do they, because they would have to administer it, or maybe Representative Hicks, I don't know. I don't want to put you on the spot.
Representative Hicks or somebody from the department? Looks like we have somebody coming from the department. Welcome to the committee. If you could please introduce yourself.
Thank you, Mr. Chair, committee members. I'm Larry Hodge, manager of the policy team at the Office of Inspector General. The department has been working with the sponsors of this bill for quite some time. We agree that respite services are a critical component and a needed service for our children. We do have some concerns with the bill, and we're working with the authors on that, trying to work on some understanding the authorizations that we have for conducting background studies and ensuring that we have that authority. And then also some of the exception language in the bill we're working with the authors on.
Okay, very good. Thank you. And I also know this will be eventually going to Human Services Finance Committee, so you'll have time to work on that for the next stop also. Representative Backer.
No more, thank you.
Thank you. And next I have Representative Baker.
Mr. Chair, and thanks. I think the idea of this bill, Representative Hicks, is pretty aspirational. I mean, it's a great idea. Respite is important for our families, especially when moms and dads don't get that break. I, like you, want to trust all these folks, but what it gets down to is we've got we've got a lot of issues right now that we're trying to just get the department where they can actually catch their breath and get to where they can stand up their current stuff that we're kind of shoving at them. And I'm a little concerned that with some of these concerns, and again, not knowing the real cost, which is, again, I know the next stop. But in your bill, if you could, how much could a family utilize this service? Would there be parameters? Is it once a month? Is it once a year? Is it every weekend? Help me just, what does that look like when it comes to how much of a respite offering should this bill try to offer people?
Representative Hicks.
Yes, thank you. I will let my testifier go into the details.
Ms. Grafstrom.
Yeah, thank you, Chair Fisher and Representative Baker. So there are specific caps in this bill of how many consecutive days a kiddo could be in an unlicensed setting, and that's capped at 10. So you can't, right now you can be accessing respite, I think it's for up to 30 days in a row in a licensed setting. This is capping the stay in an unlicensed setting at 10, and that's taking into account the potential of a family vacation or something that might last a little longer than the weekend. And then in total for the calendar year, right now the language caps that at 46 days for the entire calendar year. We do have language in the bill that would allow for the guardian and case manager to request an exception for that number of days. And that was one of the pieces that Mr. Hosh just referenced that we're still working on with the department. But right now in the bill, it is capped at 46 days in an entire calendar year for an unlicensed setting.
Representative Baker.
Thank you. Yeah, lots to work through. Again, I appreciate the department's, coming down and saying they're still working with this. I think it's a very good idea. I wish we were in a better place financially and, in other areas about this whole human service thing with our mental health crisis that we're under and so on. But again, I know this is that's what bill is. It's an idea. It's throw things forward. I'm just trying to catch up with a deep breath of what we're at and where we're at and where the department's at, because I get to see the department from a different light sometimes because of my other work. And so, again, I raised some concerns and looking forward to seeing what this looks like on the next stop. So thank you, Mr. Chair.
You're welcome. Thank you, Representative Baker. Not seeing any other questions out there or comments at this point in time. Representative Hicks, would you like to make any closing comments?
I would, but now I'm in the same camp as Baker and Backer, so. Thank you so much for hearing the bill, and I just want to reiterate that this isn't becoming the Wild West. This is parents and case managers working to come up with solutions that work for individualized families, really focusing on that person-centered model for the children, their families, and really working with their case managers. So I just want to assure everybody, as a parent of kids with different abilities, I would never just be like, anybody can do respite. But I do trust families, and I do trust case managers to find people that make sense for their children. So I want to say thank you again for hearing the bill, and hopefully we can work out some of the technical difficulties that were.
Okay, very good. With that, Representative Hicks moves to re-refer House File 3711 to the Human Services Finance Committee. All those in favor signify by saying aye.
Aye.
Those opposed say nay. Motion prevails and the bill is re-referred to Human Services Finance Committee. Thank you to our testifiers and thank you, Representative Hicks. Our next bill on the calendar today is House File 3938, a Representative Curran bill. Representative Curran, if you'd like to come down to the testifier, and would you like to move your bill?
Yes, thank you, Chair. I move to re-refer House File 3938 to State and Local Government Finance and Policy Committee.
Thank you, Representative Curran. I believe you also have an author's amendment.
Yes, I do. This amendment is just to get the bill into the shape that I prefer. So I would move that the A2 author's amendment to House File 3938. I move the A2 amendment.
Okay, thank you. Is there any discussion on the author's A2 amendment? Hearing none, all those in favor of approving the A2 author's amendment signify by saying aye.
Aye.
Opposed, say nay. Motion prevails and the author's A2 amendment is adopted. Back to House File 3938 as amended. Representative Curran, please introduce your bill.
Thank you so much, Chair. Today, members, in front of you, you have House File 3938, which is a bill brought forward by ARM, the statewide trade association of residential providers supporting people with disabilities. This bill would exempt group homes, which are licensed under Minnesota Statute 245A, from being regulated under a city, town, or county's rental regulations. And I did want to mention that this bill does have bipartisan support on the Senate side. The need for this bill came from a growing trend of cities using their local rental regulations to keep group homes from coming into their cities or forcing them out of neighborhoods. And before I continue, I just wanted to address a couple of letters that were in members' packets in opposition to the bill and offer some of my comments on those letters. The letter from League of Minnesota Cities, who I have talked to, we had a great conversation last week about this, but I just want a couple of notes on the letter. They're referring to the city's ability to have their own licensing mechanism. They're saying that it's related to the livability, safety, and conditions that might arise throughout the course of the year that DHS licensing would not catch. And I just want to make sure that members are familiar with the rigorous licensing that group homes already go through the state. And I can't say that I've seen what a city inspection would look like, but I'm fairly certain it wouldn't look like the 13-page checklist that's used to license 245D homes, with nearly 70 different line items that go through different parts of the house and how people are cared for and what items they have, including review of a program abuse prevention plan, specific items to be in a first aid kit located at the home, documentation regarding personal items like furniture that does or does not belong to the person, documentation proving 3 nutritionally balanced meals per day, and how food is obtained, handled, and prepared within the home. Again, I don't think that a city rental inspection would go quite this far, so I think that the mechanism we have in place is more than appropriate to ensure livability and safety conditions. I also wanted to point out in the League's letter, that the willingness or the want to offer residents an avenue to address conditions of their housing. And I just want to make sure that members and the public are aware that the appropriate mechanism for reporting any concerns about conditions or the treatment of vulnerable adults should be directed to what we call in the field as MARC, or the Minnesota Adult Abuse Reporting Center. That is the appropriate place to make any concerns regarding a licensed group home. The city actually is not the appropriate place to make that, because there's a whole system of people in place whose job it is to be on that report, investigate promptly and thoroughly, and then the agency that might receive that report against them has to divulge a whole host of records to make sure that the state can determine that there's no wrongdoing there, or find if there is. And then as far as the Metro Cities letter, I again wanted to address, there's a line in there that cities, with ordinances like this that are intended to protect the safety and residents of the community. And just so members, and again, community members are aware, there was a shift in how we operate in this space several years ago. When we implemented the positive supports rule and the accompanying 245 language and statute, in the past, people essentially wanted to keep those who are vulnerable in a bubble. And that was meant in good faith. That was meant, this is a vulnerable group and we want to keep them from anything possible that may cause them harm, or may cause them to feel sad, or may cause them upset in any way, shape, or form. But we know better now, and we know that keeping someone in a bubble is actually removing a piece of dignity from that person's life, to move through life and experience it just as any individual, like anyone in this room might. So I just want to make sure that folks understand that when we place these additional restrictions because we think it's safer for that group, we are actually removing a component of dignity from that group. I just want to be clear about that. A couple other things, I've heard concerns about staff behavior at a group home, and again, there are other mechanisms to address this that work well and they work fast. One of the major ones is workforce authority. You have to go through a background check in order to get this job and be on the premise of this location. If you fail to follow through with any of your employer's policies, or certainly if you were to violate any vulnerable adult law, not only should you and would you lose your job with that provider, you also, depending on the circumstance, might lose your ability to work in the field entirely, either temporarily or permanently, depending on what that offense was. And then, of course, anything crime-related, that's a law enforcement issue. And you don't even have to be a resident in the area for you to, if you're breaking the law and you happen to be in the community, it's the local law enforcement who's going to take care of that and who should take care of that. So it's just like anyone, resident or non-resident. And I'll just go on to say this bill aims to protect the right of everyone to live in communities they choose and protect people from NIMBY regulations that result in discriminatory actions against people with disabilities. Here with me today to provide more detail on the bill is Sarah Grafstrom with ARM.
Thank you, Representative Curran. Ms. Grastrom, welcome back to the committee. If you'd like to introduce yourself again and begin your testimony, please.
Yes, thank you, Chair. Good afternoon again, Chair and committee members. For the record, Sarah Grafstrom, the Senior Director of State and Federal Policy with ARM. Minnesota's having a long overdue conversation about the importance of everyone having a place to call home. House File 3938 seeks to address an emerging issue with state law that threatens the constitutionality protected right to live independently and in a neighborhood of their choosing for people with disabilities. Almost 60 years ago, the Minnesota legislature passed a policy position affirming that it is, quote, "It is the policy of the state that persons shall not be excluded by municipal zoning ordinances or other land use regulations from the benefits of normal residential surroundings." The legislature went on to pass language requiring residential programs with a license capacity of 6 or fewer persons to be considered a permitted single-family residential home. This language was necessary at the time because cities were attempting to zone out group homes from their communities by classifying them as businesses as opposed to the residential homes that they are. In cities and counties across the state, group homes operate as valued neighbors and safe settings for people with disabilities. But a patchwork of local regulations and arbitrarily applied municipal rental codes threaten housing stability for people with disabilities that need it the most. In recent months, we have seen news stories about cities revoking municipal rental licenses for various reasons, often ranging from neighborhood nuisance to overuse of emergency services. By revoking rental licenses, cities are de facto vetoing DHS's licensure process by telling the group home they cannot operate and repealing the rights of the people with disabilities living there by forcing them to find somewhere else to live. We've also heard troubling public comments from local elected officials, with one city council member suggesting that Minnesota should go back to the long-gone era of non-residential settings and to, quote, "realize that not everyone can live next door in a residential setting." Comments such as these should send a chill down the spine of every disabilities right advocate. People with disabilities have a right to live where they choose, and we need to do everything we can to defend that right. Proponents of the status quo will say this is part of having local control in cities. While a rental license is an important tool that cities have to serve as a protection for both renters and their surrounding neighbors, our members have shared stories of rental licenses being used to restrict who can live in certain communities. We have also heard proponents claim to need rental licenses to protect the rights or to protect the residents living in the homes. Thorough and extensive licensing regulations, as Representative Curran referenced, with the Department of Human Services are already in place with group homes throughout the state, making them some of the most well-maintained care settings available to Minnesotans who need them. In fact, many cities look at the state regulations that are already in place specific to group homes and use that as reasoning to carve out group homes from the residential rental licensing ordinances. By exempting residential programs in permitted single-family homes from municipal rental licensing regulations imposed by any town, municipality, or county, we are helping to ensure that people with disabilities have the right and choice to live in whatever community they choose, get rid of confusing patchwork of regulations which differ city by city, and retain the safety and quality standards which are already imposed by the Department of Human Services. Mr. Chair, that is a brief background of the and a summary of the changes, and I'm happy to answer questions.
Thank you, Ms. Grafstrom. I also have several other testifiers. Next, Josh Berg, if you'd like to come forward. Welcome to the committee. Thank you for being here today. Please introduce yourself and begin your testimony.
Thank you, Mr. Chair and members. For the record, my name is Josh Berg, and I'm here today in full support of House File 3938. I am a passionate advocate for individuals with disabilities and older adults, and I have been concerned about this specific issue for almost 10 years, so I'm very happy to see this hopefully finally getting addressed, and I thank Representative Curran for bringing this forward. I am a leader at a St. Paul-based nonprofit affordable accessible housing provider, and I'm an ARM board member. Also, I'm in my 10th year as a city council member for the city of Elko Newmarket, and will actually be on the ballot for mayor this fall, and an active member of the League of Minnesota Cities, and was appointed to the Metro Cities Board of Directors in 2021. As an elected official, I'm probably supposed to be up here regurgitating the company line that local control is the only way to go. That local control is critical to ensuring the livability and safety standards for our communities, and that rental licensing and permitting ordinances allow cities to quickly respond to and address issues that are, in theory, designed to protect the safety of residents and the community. The fact of the matter is, Mr. Chair and members, as Ms. Grafstrom pointed out and Representative Curran mentioned, and you likely know, there are robust state, county, and fire marshal oversight mechanisms already in place to address these issues. In fact, through the state licenses that these homes maintained, we are held to standards that often go far beyond, in most circumstances, what any rental license would ever require or protect against. As just one example, we had a recent licensing inspection this January for a home in Anoka County, and we were issued the following single correction order. Otherwise, it would have been a perfect inspection. And the standard reads, the inside and outside of all building structures or enclosures used by the program, including walls, floors, ceilings, registers, fixtures, equipment, and furnishings, are maintained in good repair and in a sanitary and safe condition. The correction order that was issued was for a rusty vent cover on the kitchen floor. Mr. Chair, members, my point is that the licensing structure in place sufficiently addresses any potential issues that a rental license could cover and so much more. This is precisely the reason why so many cities already exempt this from their ordinances if they do actually have one. I spoke with several council members and staff from cities in the metro, and the resounding theme was, why would we waste valuable city resources to duplicate something another government entity or multiple is already doing? One council member from a large metro city stated it perfectly, and I quote, most of the exceptions in our rental licensing ordinance were derived in whole or in part from other metro area city ordinances that we reviewed. State statutes allow supportive housing of 6 units or less in any zone, and we are careful not to approve ordinances or policies that infringe upon that. Regarding other facilities that are licensed through the state, because the state is inspecting those facilities, we did not want our ordinance to be duplicative of state requirements. This also seems to be reflected by those cities represented on the League of Minnesota Cities and Metro Cities Board of Directors, as what I've found by reviewing each of their city ordinances. Those with a rental housing ordinance, over 70% explicitly exempt state license settings like this. For the past decade, I've been working to remove these NIMBY-driven policies and practices that prevent our fellow Minnesotans, those with disabilities, from living in the communities they choose or desire to be a part of. Unfortunately, communities continue to find creative ways to use local control tool to limit where individuals with disabilities are allowed to live. More recently, it was utilizing restrictive zoning or proximity practices, i.e. the quarter-mile rule, which many cities have finally accepted as being in violation of fair housing guidelines and stopped these discriminatory methods. And finally, I would just like to leave you with one last thing to think about. I'm sure many of you are aware of the work being done to help keep folks out of the hospitals. I want to highlight for you all that this specific issue has been brought up at the Acute Care Transitions Advisory Council, which I have the privilege of co-chairing, and in discussions with DHS as one of the several significant barriers to finding housing and supports for individuals stuck in hospitals. Providers across the state who are in one of the cities that do require a rental license or permit are afraid to accept individuals with complex care needs because they fear the city arbitrarily and capriciously may revoke their license or permit. So let's finally take one step forward to give individuals with disabilities the option to live where they want to live and not allow discriminatory and unfair housing practices to persist in our communities any longer. Thank you again for your time today.
Thank you so much, Mr. Berg, for your testimony. Next, I have on the calendar here, Chikio Richmond. If you'd like to come forward, please. Thank you for being here today. Welcome to the committee. Please introduce yourself and begin your testimony.
Okay. Well, good afternoon, Mr. Chair and members. My name is Shakaya Richmond. I'm here today representing residential providers of Minnesota. I am the owner of an assisted living facility in St. Paul. I also own a sober housing company called Betty's Healing Homes since 2017. And so I myself have had a lot of experience dealing with city ordinances and zoning requirements. I'm here today testifying in support of House File 3938. Currently, 245D and 144G licensing requirements are extremely rigorous and go beyond the scope of any city-regulated rental license. The local licensing is duplicative and services as a vehicle for discrimination. Through my own personal experience, I can tell you that when we talk about rigorous steps and the documentation that you are required to hold a state license, the city process is nowhere near as rigorous. The steps are nowhere near as in-depth. Just as another personal experience piece of that, when we look at the city regulatory steps and versus Minnesota Department of Health or holding one of these state licenses, there's currently no platform today that talks this to where if you do have a issue within the city limits or that the city deems to be an issue, there is no vehicle for them to have a proper communication channel with the state to be able to deem if the facility setting is eligible or should continue to practice. We've recently seen city rental licenses used as a backdoor tool to prohibit or remove facilities from servicing individuals with disability. And specifically to what I just discussed is some of the concern. If there is not currently a process put in place right now for the city to be able to communicate with the state and to make quick decisions in regards to facility and the ability to practice, what we are seeing is there are some unintentional consequences that are coming out of that. And for one instance, in New Hope, the city revoked the license of the residential provider. And what this did was also, in the manner in which they did it, it actually violated the rights of the residents in the settings for setting closures. And it also put the BIPOC provider out of business. We need this bill. We need this bill to ensure such discrimination is prevented in the future. I just want to take a moment to thank Representative Curran for putting this bill forward, and I want to thank you guys for giving me an opportunity to testify today.
Thank you, Ms. Richmond, for being here. Appreciate you taking the time.
Thank you.
You're welcome. With that covers the list of people that had signed up for testifying. Is there anyone else that would like to? Mr. Hughes, if you'd like to come forward, please.
Just a minute, I gotta move the wastebasket over.
Sir.
Hang on. Thank you. Hi, members of the committee, Chair Fisher, thanks for this time. I've been here a long time, but
Make
why?
sure, I'm sorry, Mr. Hughes, could you please
Oh.
introduce yourself?
Oh, I'm sorry. I did most of it right. Thanks, Chair Fisher, members of the committee, I'm Mark Hughes. I've been around here a long time, but why have I been here? For this very issue. This very thing happened to me in February. My father passed in August. We sold our home this weekend in Shoreview. I moved to 55 and older apartment building. Yes, I'm that old. But I didn't need assisted living, and that was the fear of whether they're going to accept me or not because of I got a new wheelchair and things like that. But I'm in support of this bill and our representative here because if you look back in the history in Minnesota, in 1973, Section 504 became into play. They built the first disability apartment building in Bloomington, and I was even a big advocate of that. But this bill here we support because this isn't only one barrier that has to be lifted. There are a lot of barriers that make the disabled everyday world work. I would say another barrier we need is transportation because we're put on limited time. Some of us work for a 24-hour company that has swing shifts. Well, if you only get service till 6:45, 7, 8 o'clock, you're in half of the afternoon shift. You can get there, but you can't get back. But so there are a lot of things that need to be done, and this is a start, and this is a great bill, and I hope it gets supported, and I hope it goes all the way, because I'm going to be here to support it. And I'm just one of 5.5 million Minnesotans, but I think you're doing a great job. Thank you.
Thank you, Mr. Hughes. Appreciate the testimony. Is there anyone else that would like to testify today? Hearing none, we'll move to members' questions. First person I have is Representative Hicks.
Thank you so much, Chair, and thank you so much for this bill. I'm really tired of coming in front of this committee and other committees and pointing out why the disability community doesn't have this or pays extra for that or can't get this or is treated differently in this space or has different requirements here. And I'm really tired of fighting for people with disabilities to just have equal access to exist. And this is another attempt to try to solve that problem. Any other protected class, other people are treated not like they are something to solve, but people with disabilities are treated as a problem to solve. And this workaround that communities have found is another attempt to try to solve somebody's problem instead of truly live in community and live in inclusion and live together. People with disabilities are not other. They are our friends, they're our kids, they're our parents, they're our nephews, they're our neighbors, they're our teachers, they're our community. And to exclude them just continues to be really frustrating. So I just want to say thank you for bringing this bill forward and for naming it for what it is. Thank you.
Are there any other questions or comments? Chair Noor.
Thank you, Mr. Chair. Thank you, Representative Curran, for bringing this bill forward. Just wanted to inquire, is the 245A.02 subdivision 14 cover all the small residential settings, or do we need to add the additional ones? Because there are many settings that are single-family settings within the DHS residential settings.
Ms. Grafstrom.
Thank you, Chair Fisher, Chair Noor. So the statute that you referenced is community residential settings. In the amendment, we did add 144G, which is small 6 or less assisted living. So we tried to capture them through the author's amendment. If there's other settings, I'm not aware of those, but that's who the current bill includes.
Okay. Chair Noor.
Thank you, Mr. Chair. Just to follow up on that, I know if you have 144G and your license is revoked, that means your license for providing that service is also revoked. Is that correct?
Ms. Grafstrom.
Chair Fisher, Chair Noor, I am not the 144G expert, but in my communication with folks that represent the Residential Providers Association, that is my understanding.
Chair Noor.
Thank you, Mr. Chair. That's correct. I think because you are not allowed to relocate with the license, that has been an issue that has come before us many times. And so to that effect, I think this is a good bill, and we need to move forward with that. Thank you so much.
Thank you, Chair Noor. Representative Baker.
Thank you. My question, I think, is maybe to Ms. Grafstrom again about how big is this problem? You know, a lot of cities, you know, again, I think I heard that, you know, really 70% are doing it right and it's not an issue at all. Where is it to be, and what kind of items are we not hearing from today, so we can see and hear both sides of this issue, because this is important for local control. It is. I think we all really like the idea of local community group homes. I think in my district, I have one of the highest percentage of group homes per capita in the state, one of the highest. After Wilmer Regional Treatment closed, we have a lot of folks still living with us, and we're really happy about that. But I want to know, where are we seeing some of these items happen? What does it look like, and why are the cities really concerned about this, and how far are we to work through some of these details that they're asking us to work through?
Ms. Grafstrom.
Yeah, thank you, Chair Fisher and Representative Baker. So unfortunately, we don't have a centralized list of all of the cities that have these ordinances on their books. I have relied on some of our members doing some research, and in their research of just honestly going city by city and looking these up, what they have found is for the cities that do have rental licenses on their books, about 25% of them do not exempt these services. So it's, you know, I don't have an answer for you about how widespread or how many cities have these kind of rental ordinances in place. But I do know just from talking to our members that they are starting to see more and more of it pop up and run into more and more of these challenges as they work to get homes established in various communities across the state. So.
Thank you, Ms. Grafstrom. And if I could add on to that, is part of this is also a response to what people in the community are saying. Is in the past couple of years, I've had several group homes that have gone into my neighborhood, and I've had people, when I've been out in the yard, come up and question me about it. Some of them I've been able to explain, you know, when I've explained how the state does the licensing and everything else, go, oh, okay, just making sure that there's controls. But there are some people who have talked to me who wanted to find ways that they could go to the city and try to get the city to shut them down because they didn't want them to be there, because they had preconceived conditions of what it looks like. And that's sometimes, unfortunately, what is driving this is you've got people in the city who get to be a squeaky wheel, and because they don't like something different coming in, they'll create a reason that sounds okay, take it to the city council. And I think that is what is happening in a lot of the city council situations, is it's these squeaky wheels that want to keep things the way they are, not have any change. I'm not saying that's the case in every situation, but that's what I've experienced and seen, and that's why I very much appreciate Representative Curran bringing this bill forward. Any further questions, Representative
Yeah,
Baker?
Mr. Chair, thanks for that, because I think I'm kind of on the same pathway of thinking like you are. And then I'm going to go back to Representative Hicks's comments earlier about we got to trust our folks on these levels. And I frankly, I trust our local elected officials too. The only issue that I'm having here isn't that this isn't a good conversation, but we need to find a way that we don't completely eliminate the local voice on this when we do have a problem. It is a rigor process to get a license from the state. It is, and it should be. But also, if there's something happening with, I think even Representative Curran said this earlier, sometimes the staffing changes, or sometimes there's staffing issues that cause sort of timely issues that come up pretty quickly. And if the city feels helpless, and we've overrun them with this thing, it provides another maybe 6, 8, 9, 10 months before the next licensing thing comes up. I'm sure there's triggers that we could do to try to get into it, but my concern is that we're not allowing local voice here to be heard. And these folks ran for office too. I think a lot of our folks do want to have these community homes in our communities. I'm just really having some heartburn about just completely removing that aspect from this licensing and the model that they're trying to do. So I really do hope that we can come together with the league, with Greater Minnesota, with our cities that are the 25%ers, if you will, that are having some heartburn for some reason. You know, one of the testifiers was a sober homeowner and has done this before. She had a story, and we don't know the why they closed, but someone closed. I want to know why they closed. I want to get into the deeper details of what caused those things to happen, and I hope that we have more conversations about bringing this thing together, because this is a big deal for me when I do want to see these things expand and grow, but also I still really want to have the feeling like we're listening to our local elected officials. So thank you for the bill. I think we have a ways to go on this, so that would be my thoughts. Thank you.
Representative Curran, you have a comment?
Yes, Chair. Just in response, and thank you, Representative Baker. I certainly appreciate your comments. And as I mentioned too, when I met with League of Minnesota Cities, I'm certainly willing to look at language if there is a compromise. I simply have not seen that yet. I've heard a lot of opposition without any potential solutions, and that's where we're at right now. But I would be happy to work on that. Just a couple of comments, and I really appreciate Representative Hicks' comments earlier, and these kind of all go together. Rep. Baker had mentioned, you know, what is the other side of this issue? The other side is treating people with disabilities differently from the other residents in our communities, period. that's the other side. And as far as, considering a local voice in this process, sure, we have elected officials and we have processes by which you become an elected official. And as most are aware, there are a lot of accessibility barriers to becoming an elected official. And one of those is certainly being a person with disabilities. And, I know that there are a few of us who are open about having disabilities here today who are elected officials, me being one of them. But there are a lot of folks who don't have the ability or the resources to run for office to become an elected official so that their voice is heard. And that's why we are here. We're here to be the voice of the people who cannot make their voice heard at the table. And we need to do that here at the state level, at the county level, and at the city level, over and over and over again. So that's what this bill is here. That's why this bill is here before us in the shape that it's in. I just want to make sure that we had addressed those. Thank you.
Thank you. And then I've got Representative Backer and then Representative Finke.
Yeah, thank you. Mr. Chair, this is more so, and unless I'm missing something, we're going to allow license, there would be no license requirement capacity of 6 or fewer people from a rental license regulations. I get that. My only concern is you're going to have a lot more facilities that may be 6 or less. We're already having staff shortage. I'm just concerned that everybody's going to say, it just seems to me we're making it smaller, which we could create a problem. I could be wrong, but when I look at it from a perspective, if they're under 6, then you're going to maybe have more group homes set up 6 or less, so you're going to need more staff, which we're already having staffing problems right now. I'm just thinking out loud from reading the bill. I don't know. It's just something for you to share, because sometimes when government goes a certain way, the intentions is good, but people will then change your operational. If we can have one facility that helps 12, but now we have 2 that's 6 each, where does that go? From a staffing perspective, that's all. And I don't need no comment unless the representative want to.
Absolutely.
Representative Curran.
Thank you, Chair. Thank you, Representative Backer, for those questions and concerns. And you're right that we do have a workforce shortage in this field. And we have other bills that are coming before this committee that will address some of those issues because, for reasons you mentioned, in the past we had changes in statute that made some of these processes quite a bit more rigorous for providers, and that includes the standards by which we have to hire people to work in these locations. So again, that's a separate bill, but I appreciate that you're bringing that concern forward. As Mr. Hughes pointed out, all of these issues work together to try to make our systems ultimately work better in favor of our residents and our communities. And as far as, the idea that maybe a provider might go from, a 12 unit to a 6 unit or something like that, there are a variety of, issues with that. The primary one is a facility has a licensed capacity. They are licensed for that capacity already. If they were to try to be licensed under a different service that had a smaller capacity, there are processes for that. There are moratoriums on that in some cases. And, in general, there's still a standing moratorium for opening new beds in the state of Minnesota for licensed group homes. So we would not see an influx of newly created providers or new beds added to this state. So ultimately, we are looking at the same population of people that we're serving, which ultimately would be roughly the same amount of workforce needs as we currently have. So I really don't see that being an issue.
Thank you, Representative Curran. We'll go to Representative Finke, and then we'll go to the vote on the bill.
Thank you, Chair Fisher. Thank you, Rep. Curran, for bringing your bill. I just had a few comments I wanted to make. First of all, this is a very important bill, and I'm really grateful that you're bringing it. Eviction is a tool that is used to discriminate, and we should not allow people any path to using that tool. I also just wanted to say that, Representative Hicks and Representative Baker both made statements about trusting our elected officials to do what's right for their local communities. And I think that's really important, and I think that's really great. I also just want to say that I do not trust local elected officials not to discriminate against my community. I know that if I lived somewhere else, the local officials would very likely work to specifically take away the rights of my community. And we know from history that housing ordinances is one of the most effective ways for communities to determine who is and is not allowed to live in any community. And the idea that we would say we should not be proactive in eliminating the ability to kick people out of a community by preference, that's what we're doing. We're saying you cannot prefer not to have these homes, so therefore you can get rid of them. I mean, we can just say what we're talking about. That's what we're talking about. Some communities don't want to have group homes, sober homes, homes where folks with disabilities live, and they will use the tools at hand to close them. That should be illegal, and it is. And if they are finding new ways to do that, then we need to be proactive to stop that. So thank you for doing that. I am not a person who thinks our local elected officials have all of our community's best interests at heart, and I just want to say that out loud because we are here to make sure that we are protecting communities that are protected, and these communities are protected. So thank you very much for bringing this.
Thank you. Representative Curran, any closing comments, and would you like to renew your motion?
Thank you, Chair, and thank you so much, members, for the robust discussion. Thank you so much for testifiers, both who signed up and jumped in today. I really appreciate all the comments that we've had here. This is an incredibly important need in all of our communities to ensure that we're treating people equally and equitably. And with that, I renew my motion that House File 3938 as amended be re-referred to State and Local Government Finance and Policy Committee.
Very good. Representative Curran moves to re-refer House File 3938 as amended to State and Local Government Finance and Policy Committee. All in favor signify by saying aye.
Aye.
Those opposed signify by saying nay. Motion carries, and House File 3938 as amended is re-referred to State and Local Government Finance and Policy Committee. Thank you, Representative Curran, for the bill, and thank you to our testifiers. Our final bill today is House File 3835 from Vice Chair Frederick. If you'd like to come down to the testifier table, please, and move your bill.
Thank you, Mr. Chair. I move House File 3835 be referred to the Human Services Finance Committee.
Thank you, Vice Chair Frederick. Please go ahead and introduce your bill.
Thank you, Mr. Chair. House File 3835 is a bill that would allow for some unit-based services to be billed without being in direct contact or remote contact with the individual receiving the services. To kind of paint a picture for everyone, if a provider of services is at someone's house who's receiving services, they call the doctor's office to say, to set up an appointment, but somebody doesn't answer, they have to leave a message, whatever the reason is, that person who's providing services may leave. And if they are, I don't know, at the grocery store, at home, with family, whatever the situation is, if that doctor's office might call back. And because they're not in direct proximity with the person receiving services, they're left with two options. Either one, don't schedule the appointment, which then causes delay, and I'm sure everyone can kind of understand how that's not the ideal situation. Or the second option is provide that service but then not get paid for it, that they're volunteering that time for what may be the better, higher good, whatever you want to call it, but then they're not compensated for it. So the aim for this bill is for, in those types, in very specific situations, that people would still be able to bill for the time for the services that they're providing.
Thank you, Vice Chair Frederick. I understand you have some testifiers. Welcome to the committee. If you'd like to please introduce yourself and begin your testimony.
Thank you and good afternoon, Chair Fisher and committee members. For the record, my name is Ken Bentz, and despite my appearance today, I am the Director of Research Analysis and Policy at ARM. I'm doing double duty today, also representing my community as a paid-on-call fire chief for Fire Services Day at the Capitol. So you may have seen other uniformed fire people wandering the complex today, and so that's why. And Representative Backer, thank you for your service as well. So you've heard from Ms. Grafstrom who ARM is, and that is still true. So let's move on to talk about the bill in front of us today, which is House File 3835. We're going to get into some of the complexities here. This is a kind of a rate system and a rate methodology related bill. The bill proposes changes to the allowed billable time for a tiered group of unit-based services called individualized home supports, or IHS. These services are provided to individuals who are living in their own home, which is defined as a home that the service provider does not own, operate, or lease, or has no direct or indirect financial interest in. Currently, as Representative Frederick said, a provider can only bill for time providing one of these services when in direct contact with the individual receiving the service, either face-to-face or remotely. But we know that only allowing for time to be billed in these circumstances does not reflect the reality of how the services are provided. A few examples of activities and additional time spent after client visits are currently billable include times like coordinating care with a case manager or an individual support team, assisting in health coordination, like setting up or confirming medical appointments, assistance in coordinating housing, helping with economic assistance, coordinating and advocating for legal support, arranging for access to resources to meet basic needs, like with food shelves and phone and internet access and things like that. So in these and other examples, providers report needing to sit on hold for very long periods of time, plus there are many instances of playing phone tag. Since the service provider has limited time with the individual they are supporting, the staff then need to take phone calls at some time later when they are no longer face-to-face with the client. And as Representative Frederick said, they could be at home, they could be doing things with their own family, they could be seeing another client. A lot of communication also happens through email. The provider may send an initial email when they are face-to-face with the individual, but it's not feasible to wait until they are face-to-face with the individual again, which may perhaps be a week or more into the future. So this proposal that we're bringing forward would change what is considered billable time for the IHS tiered services, allowing for some indirect time to be billed, but only when specific conditions are met and only when an individual makes an informed choice to allow for some of their services to occur without direct contact. Now, I want to acknowledge that the current rate framework for these services includes a fixed component called program plan support that accounts for some of the time a provider would spend providing indirect support. But this component value has not been adjusted since the rate system was put into place over 10 years ago, and it does not reflect the actual time spent or the true cost of providing these services given the reality of today's communication processes. The changes we are proposing are completely in step with how other unit-based services allow for billing for indirect time. The 3 employment support services currently include the program support component that I just mentioned, as well as the methodology that we are proposing in this bill. Also, housing stabilization services, which are not a framework service, but they allow up to 49% of the service to be provided indirectly. We all know that life is unpredictable and providers need some flexibility to provide the level of support that people living in their own homes rely on to successfully manage their lives. Allowing providers to bill for indirect time will support individuals and their service providers in ensuring continuity of service and access to adequate support for their day-to-day lives. I want to draw your attention to a letter in your packet from Pine River Group Home, which describes the dilemma from the provider's perspective. And we also have another testifier to speak to this as well. And with that, Mr. Chair, I'll turn it back to you, and I'll take any questions.
Thank you, Mr. Benz, for being here today, and also thank you for the service in the fire protection area. Thank you very much. Our next testifier then is Ms. Larissa Beck. If you'd like to come forward. Thank you for taking the time to be here today. Please introduce yourself and begin your testimony.
Hi, my name is Larissa Beck, and I am the Director of Community Living Services at Reach for Resources. I'm here to testify on House File 3835. Reach for Resources provides IHS, individualized home supports with training, to about 75 people within the Twin Cities metro area. This is a service that we can only bill for our direct time that we are there working with the person that we're supporting, or live on the phone, like texting right back and forth for. So whether that be done in person or directly, the goal is to really be able to help people to achieve independence in different areas of their lives that they can help develop different outcomes and different goals around to further their independence. This morning, I got a phone call from one of my staff does our in-home services, and she had got a phone call from somebody that she works with who is suicidal. She was on the phone with her for 15 minutes, and so we can bill for our one 15-minute phone call that we have had with her for the day, which equates to $11.66 for that one phone call, that 15-minute period of time. After that initial phone call, the person that we support stopped responding to anybody. She stopped responding to her mom, her boyfriend, who are both her emergency contacts, her case manager, her arms worker, her employment provider, her housing supports provider, that does housing stabilization services, and our in-home staff that she works with. My staff spent the next 2.5 hours on the phone with all of the members of the team, the police, her daughter, school, Mark, the Minnesota Adult Abuse Reporting Center, and she's currently in the hospital. So we're waiting to be able to see what's going to happen with her here today and what the plan of care is going to be. My in-home staff will need to be able to write up the incident report that out to the team, report about the plan of care that is going to happen for the day, coordinate the necessary follow-up care, coordinate care for her daughter and who's picking her up from school today, continue to coordinate services and communicate what support is going to be needed for her as time goes on, for the rest of the week, for the rest of the month, continually. So these are things that are all required for us to be able to do as an IHS provider with training. She's also now mad at the staff that reported this, and she's not answering her phone calls anymore. So that makes it even more difficult for us to be able to get in contact with her. And rightfully so, she's mad, but it's what we have to do to be able to provide the best care for her at this time. Luckily, she started talking to her mom, and mom has been in communication with our staff throughout the day. My staff will continue to try to connect with her as the day goes on, as tomorrow happens, and by text or by phone call. But if we don't hear anything back from her, all that we're going to be able to bill for today is that one 15-minute phone call that we had for $11.66. She probably has another 3 to 4-ish hours of work to be able to do today, to be able to just follow up from what's needed and necessary from her calling the police and responding about a suicide ideation for today. So for that 6-7 hours of work, we're going to get $11.66. If we were providing employment services for her, we would have been able to bill for the time, the communication, the coordination, the follow-up care, for what is required that we provide to her. But she has an established relationship with her in-home staff. She's been working with her for the past 5 years. They spend about 6 to 7 hours a week together. So they're tight. They tell each other things. They've got a really good rapport and got really good relationship. And so while yes, the goal is certainly to be able to help people become more independent in the community and operate our services with the folks that we're working with, days like today happen too, and we are required to do that 6-7 hours worth of work and receive reimbursement of $11.66. So thank you for your consideration on House File 3835.
Thank you, Ms. Beck, for your testimony. Appreciate it. With that, is there anyone from the audience who would like to address the committee today on this issue? Not seeing any. Thank you all for your testimony. Members, any questions or comments? Not seeing any. Vice Chair Frederick, would you offer any closing comments and renew your motion, please?
Thank you, Mr. Chair and committee members. I just want to say that the intention behind this bill is also to not take away anyone's ability to make their own decisions, right? That consent piece is huge, is core to this legislation too. So I just want to thank you for the committee, and I would renew my motion to re-refer House File 3835 to the Human Services Finance Committee.
Vice Chair Frederick moves to re-refer House File 3835 to the Human Services Finance Committee. All those in favor signify by saying aye.
Aye.
All those opposed signify by saying nay. The motion prevails and House File 3835 is re-referred to the Human Services Finance Committee. I want to thank everyone for a good meeting today, and most importantly, I'd like to thank Sean Herring for filling in today for Nick, who was taken out all of a sudden, and I appreciate your assistance. Our next meeting is going to be on Wednesday, and as a heads up, we will be starting an hour later on Wednesday because of the change in the schedule, and for those who'd like to attend the funeral Wednesday morning. So we'll be starting at 2, and we'll be going from 2 to 3:30 on Wednesday. We'll be hearing bills that will be coming from Representative Feist, Frederick, Hicks, and Curran. And seeing there's no further business for this committee, we stand adjourned.